We're back with another Healthy Dose podcast. I'm Dr. Joe Gambardella and Dr. Buzz Korth. We're your Healthy Dose hosts. Check us out at apmrmiami.com and buckeyepmr.com. We're here today with Mark Kazanis from at Mark Method Fitness is where you can check him out on Instagram. He's got over 17,000 followers. He's only 26 years old. You definitely got to check out his website, macmtdfitness.com. Mark is near and dear to our hearts because he interned with us over when you were at FIU a couple of years ago.
Correct.
Welcome, Mark.
Thank you.
Welcome back. But the reason we have you on, it's a great story. People need to hear about it. You've been in practice, I would say, 4 years as a trainer now. You've helped and changed hundreds of lives with diet, exercise, counseling, nutrition. Really always educating on proper form, proper technique, doing things the right way. And the reason we had you on today is because even doing those things, you developed a serious injury that pretty much took everything away from you.
Unfortunately, yes.
So talk to us about that. Before you even came to see us, what happened?
Well, this shoulder has a long history. About 6 years back, I had my first labrum tear. I actually went in for a slap tear procedure. They corrected it. I would say maybe a month later, I went back to the gym. They told me to wait 3 to 4 months, so I ended up re-tearing it. I had a second surgery for the same injury about 8 months later, and then I was good for about 3.5 years. Next thing I know, I wake up, it's kind of bothering me again, so I'm thinking I re-injured it. I probably went another year or so without, addressing it, getting an MRI done, seeking any, your help, professional help. And I just kind of pushed through it until finally about 5 months back, I went and got an MRI through you guys. When I finally got the MRI, I found out it was something pretty serious. You told me it was a full thickness tear. So then from there, you gave me the option of stem cell. You explained to me how it worked. You explained to me, people have had great results with it already. So I said, why not? I have nothing else to lose at this point. So I went for it, and I think we started in November was our first time doing it. And now it's, I want to say, 3 months in?
Yeah.
3 months?
Yeah, November, December, January, almost 4 months.
And I would say I'm at 90% of being healed. I'm doing things that I wasn't doing last year. I'm finally able to, lift above my head. Strength-wise, I'm twice as strong as I was 4 months, prior to this, getting the stem cell. And it's just amazing for somebody in my line of work to see that this can actually heal somebody and give them that quality of life that you think, I need surgery, or that there's no cure for.
Yeah, Buzz, even taking it a step back, this is one of the things that you always talk about is there is no such thing as a normal symptom. Pain is always an indicator that there's something wrong. And Mark, as an athlete, Buzz, you see it all the time. This is what really takes people from maybe PT and simple correction into these more advanced procedures. Talk about that for a second, Buzz, the urgency, the necessity of not overlooking symptoms. There is no such thing as normal pain.
Yeah, pain's there to tell you something's wrong. I always tell people, if you have pain anywhere for more than a couple weeks, it's not going to get better on its own. Now, if you stub your toe or something, obviously it's going to heal up. But in a situation like this, he had pains for months at a time. This is what he did for a living. That condition would have only got worse with time. So, he did the right thing, got professional help. And we see these people every day in the office. But, what you also got to realize is the longer you wait to fix it, the harder it's going to be to fix. Mm-hmm. So really, I tell people, when they first get injured, if I see someone at the gym, hey man, ice it, stretch it out, see how it goes. If it's still hurting you in a couple of weeks, then come see me.
Yeah, it makes the most sense. You're lucky in the sense, Mark, that you had 2 surgeries and were still able to have such an amazing recovery. It's because of your age. You're only 26 years old. You saw all these people coming in. You were actually treating them here in the office.
Yes.
You interned with us. You were a PT intern, athletic trainer intern. And you were helping people with necks and shoulders and lower backs, let alone did you think you'd be one?
Nope, I did not. But, sometimes you tell people to do certain things, you don't practice it yourself. And I guess living this lifestyle, you think it's not going to happen to you. You think you're invincible.
When people check you out on your website and on your Instagram, and they see this person, you're like Mr. Miami. Everyone wants to really look like you, have that fit look. And when you get into shape, this is one of the mindset things that kind of catches you at times is when you're in the best shape of your life, you don't want to stop.
No,
it's another thing that kind of perpetuates the injury, right?
You don't want to go backwards. And it's a lot of people don't know, but somebody may look their best, but it doesn't mean they're feeling their best, which is what I went through for a while. That's kind of why I postponed this for a while. When it's your business, I'm pushing through the pain because it's my business. It's what I do for a living.
And you can't be an athletic trainer coaching people on how to lift with proper form and have your arm in a sling, or you can't even lift it up from your side.
You got to lead by example. Correct.
Yeah, yes. Shoulder surgery is pretty tough. I mean, with your past labral tear, how long were you in the sling, or how long were you not able to work out?
I was in the sling about 3 to 4 months, and then I would say I wasn't back to lifting, at the same intensity for almost a year.
Yeah, so that's one of the reasons why you would be hesitant to even have it. So you came in, we did some examination of the shoulder. We found out that you had decreased range of motion, pretty much in flexion,
Big time.
external rotation, internal rotation. The difficulty that you had was primarily with what exercises?
Lateral raises, I would say anything that involved the anterior delt, so a front raise, a push-up, a overhead press, dips, just anything going in front of me was pretty much a no-go.
Outside of the gym, trouble sleeping?
I would
Driving?
actually driving, and then simple as turning the key when I would open the door, when I would rotate, externally, when I would supinate my palm, I would feel it in my shoulder. That's when I knew it had to be bad.
So you know what I was going to do, Buzz? I was actually going to read the MRI. We talk about it often that we're only as good as our diagnostics. So really having the best facilities around getting the proper diagnosis means that we can dispense the best treatment. But this is what Mark's MRI said. He said he had a downsloping type 2 acromion with impingement of the supraspinatus tendon. He had a full thickness tear within the supraspinatus tendon with subacromial bursitis at the distal portion of the tendon. There were some changes that involved cystic changes of the humeral head laterally. There was enlargement of the AC joint. So in other words, this is all consistent with the type of injury that you had. If you get to be Buzz's age and my age, when you're closer to 50, most people are going to have some issue with the labrum if they've worked out, if they picked up kids. But wear and tear. But when it's slow progressive wear and tear, it doesn't typically come with the severe amount of pain that you had. But when you have a tear of the tendon, I think it's really important to describe what a full thickness tear is. We went through that, if you remember, back in the office. You can have a partial thickness tear or a full thickness tear of a tendon. If there is not disruption of the tendon with retraction, most likely it could be treated non-surgically. So, if you're going to imagine, cutting into a piece of steak, if you take your knife and cut through it halfway, that's called a partial thickness tear. If you take your knife and pierce the steak top to bottom but don't cut it left to right, that's a full thickness tear without retraction. And that's what you had. So when we reviewed this with the radiologist, he said, you know what, the best way to go, because you were so young, you had the history of the surgery, and you wanted to stay active, was to really to get your body to heal again. And we went through the P and the P, Buzz. We did the PRP, we did the Prolo, and we did the tissue graft that contains the Wharton's jelly. So why don't you start out, Buzz, he has the best explanations for this, really great analogies. Start out, number one, with the age, Buzz, why we elected to put in PRP, how the Prolozone and then the cells, why it works so well with Mark.
Yeah, great question. So, PRP, which is platelet-rich plasma, which we both use at our facilities, is the patient comes in, we draw the blood out of the patient, their own patient's blood, and we spin it down and we grab what we call the platelet-rich plasma. And the best way I think to analogize this is it's basically food for the person's cells and food for his own stem cells. PRP is very effective, in my opinion, people that are 35 and below. Once you get above 35 years of age, unless you're a diabetic or something, the PRP does become a lot less effective, and I'll see physicians doing PRP in 70 and 80-year-old people. It doesn't make a lot of sense because, number one, the persons don't have any stem cells to feed. And number two, the quality of that PRP, and I know you can attest this, Joe, you'll just get less PRP, right? The same thing if you have someone who's diabetic or smoker, the PRP is just not good. So that was a good choice for him. But obviously, his tear must have been really significant. You went with the tissue allograft, which is from basically we get it from umbilical cords. Females that have full term births, and what they do is they take the Wharton's jelly, which is the center of that umbilical cord, and we can put it to a person's joint or into a muscle tear like this. And what happens with that is that tissue is loaded with stem cells, loaded with exosomes, cytokines, structural proteins, and that cushioning and structural support that it provides with all those extra things propagate the body to heal itself. And basically you're just supercharging its healing, because once you're through puberty, these things don't heal on their own in general, and the joints, the tendons, the ligaments. So, if you have a kid in puberty, PRP by itself works fine, but he's past puberty. Are you past puberty over there?
I hope so.
Okay, yeah. They just don't heal well, and he would end up with a full thickness tear with retraction if he would have continued on. It was just not if, it's when. So what you did by putting that in there is just you got his body to wake up and actually heal itself, and I expect that this time it's almost 100%.
Yeah, it is. I would say there's certain things that I still haven't tested, but I would say definitely 90% at most, and that's that I haven't pushed myself to doing the weight I was doing 6 or 7 months ago, but I'm definitely able to do full range of motion on my overhead press. I'm able to do lateral raises again. I couldn't do any of those things without severe pain, even if it was just a motion with no weight. Now I'm back to doing it with weight and no pain at all. So I think
one of the beauties.
The final test would be, going back to lifting what I was lifting prior, as far as certain presses and stuff like that, with no pain. So 90% more or less.
One of the other beauties of these type of procedures, like the stem cell procedures that Dr. Joe's doing down there, is really there's no post surgery really. I mean, you don't have your arm's not in a sling. The procedure itself really is not uncomfortable, and your body's going to tell you what you can and can't do. So if you don't have pain, go for it. Patients ask, well, what are the after I get the procedure done, what do I have to do? Well, I always say for the first 2 weeks, we want you to pretend you had surgery, even though it's not going to feel like it. But then after that, if it doesn't hurt, go for it. If it hurts, don't do it. Your body will tell you what you can and can't do.
Correct.
And we also don't know the outcome. But, I always tell people expect about 10% improvement a month for 10 months. Mm-hmm. After 10 months, that's probably as good as you're going to get from that particular procedure. So it's that simple.
10 months. Yeah, we're only 3 months in.
That's it.
So I'm excited because we're 3 months in and I feel this good.
Yeah,
can't imagine.
You're ahead of schedule. Way ahead of schedule.
So how has this changed just your overall, your not just your working out, but life, feeling back to yourself
put
again?
It this way, if you live your whole life in pain, constantly in pain, you're going to be a little cranky here and there. You're going to be you're going to be very easily irritated by any little thing. So quality of life has definitely increased significantly. I would just be, watching a movie. I would be in the movie theater and my arm would just start kind of, flaring up, and I would start having all kinds of pain, moving my arm around. And that's, it's frustrating. It's really frustrating.
I remember, Mark, too, as you were going through your recovery, we're about maybe 3 or 4 weeks in. Maybe you said, I don't want to say 40, 50, but it was feeling better, but it was still there. It was uncomfortable.
Yeah, I remember about week 3 or week 4, I was doing a lot of, people would start Googling and start researching themselves, and you kind of get desperate. You want it to work so bad. And it was saying like, by week 3, you should have no more pain and it'll start working. So week 3 kicked in. I think it was literally the start of week 3, and I was like, man, I still have some kind of pain. I came to you. I was like, I don't even think it's working. I don't know if it's going to work for me. I don't know if we should do another shot. End of week 4, and I was like, wow, what just happened?
Yeah.
Why is it not clicking? Why is it not popping?
Yeah, yeah. And I think it was by even some of your urging, for having worked here and, been around so many people yourself that you've worked on. You mentioned to me about downsloping of the shoulder, or maybe it looked like, you were having trouble getting it into external rotation.
Yes.
And we really just went back to basics. We took additional x-rays. We looked at the spine, the position of your hips, and we found out that you had some really severe rotation of the hips that affected you all the way up into the shoulders.
Yes. I would say there was a lot of compensation, all over the body, trying to kind of avoid any pain or any of those symptoms. So things were thrown off,
Yep.
to avoid pain.
And so after doing the x-rays, we did some basic adjusting, adjusted the hips, the middle back, lower back, did some kinesiology, trigenics, where we strengthened the supraspinatus tendon, worked all the external rotators, the teres minor, the infraspinatus, and I think that was almost one day to the next that you noticed.
Oh, yeah, instantly. I had some really bad winging of the scapula, and it would come in and out. Doing anything. I would be laying on a bench press and I would notice that my scapula was hurting because it would be poking out at the bench. The same day we did the adjustment, it was gone.
Yeah. I mean, sometimes it's just simple. Yeah. Simple is better, Buzz, right? We always learned.
There's no cookie cutter. We always keep talking about that. you could have two people come in with the same exact injuries and the treatments are totally different. So that's one of the advantages. Your facility, my facility, you have medical providers, physical therapists, chiropractors, and we all look at it because the reality is they all bring something to the table.
We learned about one of the first things we had way back when, Buzz, God, so many years ago now, was anatomy and physiology. And the first thing they taught was osteology and then the muscular system. And they teach it in a way, and everyone knows the term is the musculoskeletal system. Nobody says the skeletal muscular system, but it really does a disservice because the muscular system is a byproduct, only works as well as your foundation. And
correct.
There's so many amazing people like you, Mark. You go to your Instagram page, Mac Method Fitness, and you see all these body transformations. But what you don't see is how many people are hurting.
Correct.
And if you would address some pretty simple basics, looking at the feet, looking at the knees, looking at the hips, look at the skeletal system first, and then build your house, build your frame around that. You'd have people that are able to train longer, get better results. I mean, even as good as you are, people drop out, right? They get hurt. They don't.
Yes.
You don't know why. You think it's something you did, but it's really they're in pain. They don't want to tell anybody.
You really don't know. Yeah, they could be in pain and they won't tell you.
Yep.
Yeah, very true. Simple as you said. I've had clients come in and they tell me, "Oh, I'm not going to squat because my back starts hurting when I squat. So we can do anything. Before we even start, I can do anything but a squat." We do a couple adjustments to the knees, a couple adjustments, how they're placing their feet, and instantly they're squatting. And they told me they're never going to squat. It's simple as that.
Yep. So yeah, it's an amazing recovery, Mark, and there's lots more coming for you. Like Buzz said, you're 10 months in to get the full benefit. You're about 3.5 months in. What would you say to people out there that are listening that have shoulder pain, that have knee pain, that have back pain? They're kind of pushing through like you did. Is this something for everybody? It's, about the pricing, was it affordable for you? All those things.
Well, back to what Buzz said. The sooner you catch it, the easier it is to correct the issue. And then from there, it's kind of like, what's the priority for me? I thought health is everything to me. It's the priority. I'd rather spend the money on this than anything else. And surgery for me is not an option. It's, as it is for many people, it's not an option. People need to live their life and not be in a sling and, be basically they're going to be very restricted. Surgery is very restrictive. It will take away a huge quality of life. And if you're in my fields, in any kind of field where you're hands-on, it's really not an option. It's going to kind of harm your business. So this is worth every penny and some. I would definitely do it again.
And what
you got to understand, surgery is risky too, Joe. You can speak that yourself. You had an injury that required surgery. It was you had a torn pec with retraction. So that was surgical only. And you might want to explain your situation. But a lot of people just think, insurance will cover my surgery. It's not a big deal. I mean, Joe went to the best surgeon. Joe's healthier than most people at his age, and you could have died.
Yeah.
And that was just last year. So, I mean, there's risk always with surgery.
Yeah, you hear about, the big topic in the news now is coronavirus, that even the healthiest people are contracting this. And any virus, any bug, any bacteria, mold, yeast, we're host organisms for these things, and, like Buzz said, when basic simple injury, right, that you tear a muscle, there's no choice, you have to do surgery. And it got infected, and I had to deal with the consequences. It was a very, very long recovery. Something that should have taken 12 weeks took more than a year, and I'm lucky to be here because those bacterial infections, the cellulitis, the complicating factors from doing these procedures, they can be life-threatening at times. So we talk about our whole process here, kind of bringing a first circle is think about surgery as a last option.
Yes,
not the first.
definitely.
I mean, people's frame of mind is everything's fixable as soon as there's pain with no work, right?
Definitely.
You get people that come in and they say, I want to look like you, but I don't want to work for it.
Yep.
They don't want to do the training. They don't want to do the diet. And I'd attribute what you did, Mark, and Buzz, you could comment on this too, is that, how many people go in there and lift weights year after year after year and their body never changes?
Oh, yeah.
They look worse.
See it all the time.
And it's all the diet. It's
Yes.
all the food that goes into the body that causes the transformation, just like
Correct.
what you did with your shoulder. So
I agree.
I'm sure a big part of your practice, Mark, your gym. To actually tell us where your gym is.
Well, my gym is actually on 132nd Avenue and Northwest 2nd Street.
Okay, so what do you do there? Do you do personalized diet, nutrition counseling?
So
Who do you work with?
it's a studio, and basically, I do one-on-one training. It can go up to 1-on-2 training, and basically it's just, you're taking people who have never really worked out for the most part, and you're just building the foundation, like we were talking about, simply just teaching them how to do things the proper way, teaching them how to, you want to make it a lifestyle for them. I call it a lifestyle change. It's not, working out. It's basically a lifestyle change. You're teaching them how to eat properly, teaching them how to sustain this lifestyle, with the working out. Nothing extreme, just sustainability is, the priority.
So when someone comes in, they could be an experienced lifter and an inexperienced lifter. They can expect, do you have the ability to work with them multiple times a week if they choose?
Well, there's an intensity, there's a level, and everybody progresses different. So, I'm not going to train somebody who's been an athlete at the same level as somebody who, is a soccer mom and they're just getting in shape. It's priorities. Their priority is health versus an image or versus a sport, so everybody's going to be on their own regimen. Everybody has their own plan.
So if someone's an athlete and they have specific goals of wanting to cut down time on a 40, or they want to lift more, or somebody's a soccer mom and they have goals of wanting to fit into their bikini by the summer, you have a plan for all those people?
For all of them. Everything is according to the client. It's adjusted, it's personalized for the client.
I think one of the best parts about, I've seen your befores and after marks, those transformations. People get, a lot of people can get into the gym, but they may not necessarily know how to do cardio the right way. But the diet is tricky, right? In bodybuilding. And you take that, make it very easy.
Simplify it to a T, to where anybody can follow it. So I pretty much dummy proof, what I've gone to school for so long, and I put it, I cut it in half. I basically cut the time in half, and they learned something that took me 4 years to learn within a month.
Yeah.
So yeah.
That's as a segue into you, Buzz, too. It's you're as a national spokesperson now for these tissue grafts for Regenerative Labs. You take something that we went to school for a long time, spent many hours on, and you give very simple explanations. It doesn't mean that the technology is simple in any way, but you have a unique ability to describe this in ways that people can understand. It's accessible to everyone, right?
Yeah, and anyone can afford these procedures. I mean, I think a lot of people think, stem cell therapy is going to be too expensive or it'll be outside my thing. Anybody can afford these procedures at this point. There's more and more of them getting done. The tissue prices have come down, and there's no reason not to at least look into it. And just because your doctor told you need surgery, the majority of people we do procedures on have been told they need to have surgery, and they actually don't. So always come and get a second opinion. Go to a facility like Dr. Joe's or ours up here in Ohio and see. And if you need surgery, we'll tell you. Like, there's certain situations that need it, but surgery is overdone, in my opinion.
Yeah. So we're glad we had the opportunity to work together again, Mark. I know we're not done. We got a lot more to go. Before we sign off, I'd be remiss to say, Dr. Buzz, want to wish you a very happy birthday. You turned the corner. You hit a big milestone. You had a fun time this past weekend.
Oh yeah, it was great. Went to the fight.
Yep.
Hung out, so it was a good time.
Made it back for the show. Yeah. So
yeah, made it back.
So Buzz,
this weekend.
When people are listening to the show, both patients, when we have other doctors that want to learn more about the products that we use, the tissue grafts with the Wharton's jelly, how do they get in touch with you? Where do they go?
You can go right to my website, which is BuckeyePMR.com. BuckeyePMR.com. Check it out.
Okay, great. So, Dr. Buzz, Mark, we're going to be back next week. We're going to be talking about regenerative medicine, bioidentical hormones, all the things that you need to do to stay healthy, get healthy, be fit for summer, and get back to the life that you want, get back in the game. We'll see you next time.